Hi, good evening. Welcome to the third and final episode of the PsorPhil Speaks. For millions of people, chronic illness and depression are facts of life. A chronic illness is a condition that lasts for a very long time and usually cannot be cured completely. Although some illnesses can be controlled or managed through lifestyle like diet and exercise and certain medications, many people with this illness becomes depressed. In fact, depression is one of the most common complications of chronic illness. It's estimated that up to one third of the people with serious medical conditions have symptoms of depression. And tonight we are very lucky as we talked about the depressions and anxiety amidst the COVID 19 pandemic among people with chronic illness. Uh, we are in for wonderful discussions by these two champions and experts. Take it away, Pong.
Yan. So, good evening, everyone. Let me introduce our first guest for tonight. So, she obtained a medical degree at University of Santo Tomas, and currently, she's the general and adult psychiatrist in Makati Medical Center, St. Clair's Medical Center, and the Medical City. She is also the Vice President of the Philippine Psychiatric Association and President of Samahang Tumataguyod sa Gawaing Pangkaisipan. Let's all welcome Dr. Luz Katigbak.
Hi, good evening. Good evening, Joseph. Good evening, Paul and Dr. Gia. It's a pleasure to be here tonight. And allow me to congratulate you dun sa past two successful shows ninyo. Okay?
Thank you, Doc Luz.
Thanks, Doc, for being with us tonight. And for our next guest, she's a medical doctor, a breast cancer survivor, and a mental health advocate. So as a health leader, she served as the National Secretary of the Philippine College of Occupational Medicine and a board member of the Philippine Medical Association Committee on Continuing Medical Education. She was a former consultant to the World Health Organization and the International Labour Organization for the global practice of occupational health. She also previously served as the Chief Medical Officer of Global Telehealth Incorporated, and currently she is the head of the Women's Wellness Center at Makati Medical Center. As an advocate, she serves as the first Philippine leader of Live Strong Foundation, an international NGO that aims to improve the lives of people affected by cancer, and she is also the national advisor of the Youth for Mental Health Coalition, an NGO composed of youth advocates who aim to improve the Philippine mental health situation. She is a strong advocate for mental health in the workplace and currently works with companies to improve wellness of workers. She is also a media personality. She regularly appears at Boys Night Out at Magic 89.9, hosts a web series, G Talks, on CNN Philippines, and writes in her blog, Sand and Stone, at giasison.com. So let's all welcome Doc Gia Sison. Hi, Doc.
Hello, everyone. Hi, Seth. Hello, Pong. And hi to Luz.
Hello.
And good evening. At as of this time, good evening sa lahat ng PsorPhil na sobrang mahal ko kayo talaga lahat. And to everyone yung viewing tonight, thank you. And I hope in our own small way, makatulong po kami, makapag-reach out po kami sa inyo. So, and congratulations pala, PsorPhil, for your webinar series kasi ang laking tulong, lalo na ngayon na alam natin yung access sa healthcare is a challenge. Ayan na, binukas ko na yung topic. So, maraming salamat.
Siguro, let me shoot the first question na related doon sa introduction ko. Bakit nga ba ang depression is common with people with chronic illness?
Luz.
Okay. Ako muna, Gia, no? Oo.
Okay.
Aha. Alam mo, kasi maraming factors, no? And first, yung psychological and social impact ng isang chronic illness. Di ba pag meron kang chronic illness o yung sakit na pangmatagalan, may epekto to sa buhay, malaking epekto niya sa buhay mo, no? First is yung financial burden, okay? And when we talk about financial burden ng isang chronic illness, the person feels guilty or parang sinasabi nila burden sila sa family. Naririnig niyo ba yun minsan sinasabi nila?
Yes.
Oo. And that gives rise to depression. They feel depressed kasi hindi rin, isa pa, they have no control over the situation. You know how it feels when you are not in control of your illness, of your body, of your future, then you also become depressed. So, hindi pa natin nababanggit dyan yung mga physical deformities that go with chronic illness. Kung may physical deformity, it also causes low self-esteem. And we know that low self-esteem is also associated with depression. So, napakaraming factors. But one factor also, no, to be medical about it is yung inflammatory process na associated sa mga heart illnesses, cardiac illnesses, even stroke, even psoriasis, may inflammation, mayroong inflammatory process involved. So this one causes like yung sa immune cells, they release cytokines, no? And alam na alam siguro to ni Paul at saka ni Joseph because they're well-versed about the inflammatory process in psoriasis. So, immune cells release substances called cytokines, no? Etong cytokines na tinatawag na to, they affect the brain chemicals, specifically yung serotonin. And serotonin is the chemical or the hormone neurotransmitter for which is associated with depression. So pag mababa yon, ibig sabihin parang mababa yung happy hormones mo. So that can lead to depression.
Ako sa side ko, being a cancer survivor, yung uncertainty kasi ng condition, nakaka-add rin siya sa factor ng depression. Yung you tend to question na hanggang kailan na lang. There's always that nagging question sa mind. And of course, parang in terms of functioning at work, parang nandun rin yung self-pity. Minsan na parang, shucks, ako pala, part pala ako ng vulnerable society. So parang may may kurot. Parang, if I may say, sometimes doon nanggagaling yung stigma. So I think that also adds up. Totoo yun, no? Yung self-worth, natatamaan talaga siya. And this is really coming from an actual experience since 7 years ago. Yun nga, I battled with cancer. And of course, till now, habang nag-uusap tayo, meron pa rin akong I live always with a question na parang, pwede ba ito bumalik? Yung mga ganon. So sometimes talaga, you tend to question it. So, yeah.
At and Gia brought up one specific one important aspect in depression, which is spiritual also, no? May spiritual aspect din sa depression. So it's not just mental, no? It's also physical, biological, social, and even spiritual.
Nice insights po. Ito, Doc, for the next question, related din siya. So, a lot of people with depression, they try to hide it. Or, ano daw po ba yung signs na pwedeng i-watch out for if one is depressed? Is there any physical or emotional symptoms of depression na we should watch out for?
Okay. You know,
Luz, ikaw yan.
Sige, ako muna, Gia.
Ikaw yan, Luz.
Dagdagan mo na lang mamaya, Gia.
Sir,
Okay. So, pero, this is how I explain it to my patients. No? depression is when everything is low and slow. Okay? So, ano yung mga bagay na low and slow? For one, yung mood. Parang ang lungkot-lungkot mo, baba-baba ng pakiramdam mo, even your self-esteem, your self-worth is also low. Meron ka ring low energy, so parang laging pagod, laging parang tinatamad. Yung iba, they say parang low motivation, low interest, low enjoyment. Parang yung mga dating na-enjoy mong gawin, hindi mo na siya na-enjoy ngayon. Okay? So kung dati lagi kang nagsusumba, ngayon, parang ayaw mo nang gawin. No? Kung gawin mo man, parang hindi na ganun ka pleasurable for you. And some other low symptoms that you can expect of is yung low concentration. Like, sasabihin ng iba, parang nagiging makakalimutin, hindi ako makafocus. Kaya nga yung mga estudyante, di ba, akala lang natin tinatamad or parang pag bumababa yung grades nila, sabihin natin, pasaway. We don't really know what's going on with them. Perhaps they're going through something. Hindi sila makafocus, hindi sila makapag-aral. And worst case would be yung suicidal thoughts and low zest for life, no? Okay? So parang wala ka ng gana mabuhay. Of course, may mga physical symptoms din ito, yung changes in sleep and appetite. But it doesn't mean low lang yung or poor lang yung sleep mo, hindi ka makatulog, hindi ka makakain. It can also go to the opposite direction, which is nag-stress eating ka naman or tulog ka ng tulog. So these are the symptoms of depression.
And Luz, siguro may length of time rin na tayong tinitingnan, di ba? Sa sobrang gusto ko yung low and slow, no? Pero we're looking also at how long, di ba? Nandiyan yung fact. Kasi we have to also, kasi normal yung malungkot ka kasi hindi naman lahat ng days you're happy.
Right.
But depression kasi goes deeper eh. Ang tagal niya. Tapos even minsan may point pa na you yourself hindi mo alam kung ano nangyayari sa'yo. And matagal siya. So if we were to put a cut-off, pero of course hindi po ito diagnostic talk, no? Pero yung cut-off namin is usually 2 weeks.
Weeks, right.
Oh, it's weeks. Kung talagang continue siya, and we really advocate for support to seek professional help para makatulong.
And siya, no, Gia, I'm glad you mentioned about the 2 weeks. And most especially, it affects your functionality.
Yes.
So, so hindi ka na maka-function. Kung nagtatrabaho ka, hindi ka na makapasok sa work. Kung nag-aaral ka, bumababa nga yung performance mo sa school.
Totoo yan.
Yan. So, which reminds me, no? Kaya siguro importante talaga to watch out for the signs of depression. Kasi just a few months ago, yung isang newly diagnosed patient na coach ni Pong, he jumped to his death on top of the building, no? Tinawag pa niya yung mga kaibigan niya para panoorin siya na tumalon. Suicidal na pala siya, and his friends do not know about his illness. So at walang nakakakita na may sintomas siya ng depression, no? So yun, kaya nakakalungkot kasi karamihan sa mga depressed, tinatago nila. Ayaw ipakita sa iba. So ang tanong ko nga ngayon, ano ba yung dapat unahin? I-treat yung chronic illness o yung depression?
Meron talaga kami. Both. Correct. Okay. Kasi meron kaming tinatawag na depression secondary to chronic illness, no? Lalong-lalo na yung hypothyroidism, mataas talaga yung yung chances na magkakaroon ng depression. And I did some reading also na in psoriasis daw, a person who has psoriasis is twice the risk of developing depression. So, kailangan kasi sabay nga talaga i-treat. Kasi, ano sila yung causative factors nila, pareho, inflammation, di ba, nabanggit natin yung kanina, no? And, ano siya they affect each other, so they exacerbate the medical illness exacerbates the depression. And the depression also exacerbates the medical illness. So, kailangan pareho. Imagine, if you wait for, example lang to ha, if you wait for the medical illness to resolve itself, some chronic illnesses, kaya nga chronic di ba? They're really chronic. So, we don't really expect them to get better fast. If we delay the treatment of depression, marami siyang impact. Like the person is not cooperative with the treatment anymore. Kasi depressed siya So, why would I go for my treatment for my cancer? You see what I mean? So, that in itself explains why we should treat them both. Not to mention the fact that if you don't treat depression, the immune system goes down.
That's true.
Mm-mm.
So if I may butt in, kaya malaking factor yung sinabi ni Luz na treat both. Kasi malaki ring factor yung mental health in terms of healing. No, alam natin that chronic is chronic. Matagal siya. It will linger. Kaya nga and it will always have an effect somehow sa functioning natin. That's why it's very important na mag-reach out for support. Kaya I appreciate also, like nung time ko, I can just speak from a personal point of view, no? I was looking for support groups nung time ko. Kasi parang I wanted to talk to someone na may cancer din. So parang may ganong factor and it really helped a lot nung tama si Luz, yung depression secondary. I experienced that although I wasn't formally diagnosed, pero yung support na binigay sa akin ng family ko really helped me push through with chemotherapy. Kasi gusto ko na mag-quit nung third cycle ko. Gusto ko na i-give up. In fact, kinampit ko na yung mga years ko, yung ganon. Kinausap ko na rin yung oncologist ko na ayoko na, I'm tired of the side effects. I want to go out, ganyan na. Pero, in tandem with that giving up was the support I got, and it mattered sa healing ko personally up until now. Kasi every year, meron kaming annual test na it causes anxiety talaga. So, yun. That's the important. Sa akin, that's very valuable sa healing, pag-cope.
Wow, that's good. Yun. So, going medyo related dyan na medyo nahapyawan nyo na po yung sagot dun sa next questions. Ito naman po, ano daw po ang possible treatments or pwedeng gawin when to fight depression? Na ano po yung mga pwedeng makatulong sa kanila para mabawasan po yung depression? Kailangan po ba agad medication or dapat ano po ba yung mas ideal? Lalo na po ngayon sa situation natin ngayon with the ECQ and everything.
Go, Luz.
Thank you, Gia. Thank you. Okay. Kasi I'd like to go back to the causes of depression. Sabi ko nga, may biological, may psychological, and social. No? So, to be able to get better, feel better, we have to target all those three components of depression. Especially for major depressive disorder, no? Yung moderate to severe depression, no? we need medications. Kasi sabi ko nga, mababa yung happy hormones. So what do? We give medications to somehow increase or correct the chemical imbalance. Pero syempre, kailangan din ng psychosocial interventions sa depression. And when we say psychosocial, yung therapy, talk therapy, is very important. Kasi sa talk therapy, parang nakikita mo, nako-correct mo rin yung mga tinatawag naming cognitive distortion or yung mga negative, pessimistic view mo sa sarili mo, sa mundo, sa ibang tao, no? So, importante yung psychological intervention, psychosocial intervention in depression dahil may psychological, social causes ang depression.
Kaya di ba, Luz, we advocate for as much as possible, ayaw muna natin magbigay ng medicine. As much as possible, kung kakayanin ng different modalities, especially the psychosocial aspect, then let's go for it. Pero kung talaga, if it, in spite of that, naglilinger, that's the time na medication is needed.
Yeah, you're right about that. Meron kasing mild depression, no? And we have major depressive disorder, which is clinical na talaga.
Right.
Ayan, napaka-interesting ng ating topic tonight. Before we continue, we would like to pause for a small break and we'll be right back.
We'll be back. Okay, welcome back to our third episode of PsorPhil Speaks. And we have here tonight Dr. Luz and Dr. Gia as our guest speakers. And with me also is Joseph, my co-host. We are talking about anxiety and depression. So before we continue with our discussion,
Batian time.
yeah, so hello po sa mga nanonood ngayon. Bibilisan ko lang po ang pagbasa. Hello to Jeng, to Karen from Australia. Hello to RJ
Wow.
from Mindoro. Hello, Carlo, to Ate Rose from Davao. Hi. To Jen, to Liza from Mandaluyong, to Masanori from Japan. Thank you for watching.
Wow. Hello.
To Maria Argentina, to Ian De Vera, to Vester, to Kael, to Joms, to Derry Len, to Mailu, to TJ, to Ichi Oida, to Gilbert Mata, to Christopher Tinaan, Min Escalderon, Jen Perada, Nelly Susa Reyes, Virgilio Ganigan, Joey Hoxon, to Carl, to Rocky from Qatar. Hello, thank you for watching. To Rai Tanglao from Pampanga. To Christian Malimban from Cavite. Hello. To Maylene from Bulacan. To Marichung, to Edmond, to Ingrid.
Tarlac chapter daw.
Hi, Tarlac chapter. To Winnie
Hello,
from
thank you.
Iloilo. To Kuya Bill. Hello.
Oh,
Yun.
Iloilo.
So, kayo po, may gusto po ba kayong batiin?
Pwede na ba? Sige.
Go, Luz.
Okay, babatiin ko, baka makalimutan ko ang dalawang mothers ko, si Mama Ming Octaviano at si Mama Raymunda Katigbak.
Hello.
Hello
Yeah.
po!
Thank you for
Siguro
Hello po.
Siguro babatiin ko
Classmate
rin
ko po
yung
si Luz.
mga ibang organizations who are viewing right now. Dialysis PH,
Uy, hello.
ASAPH, the Lupus Group, the Rheumatoid Arthritis Group, ayan. Lahat po ng mga member ng Philippine Alliance of Patients with Chronic Illness, binabati ko po kayo.
Ako
And
rin.
please
Hi
be
to
ready with your
Papo.
questions. Yeah.
Hi to Papo. Hi to my family, my husband, my kids, and
Dogs.
hello to RJ Nagid. Hello. Si Doc RJ is
Yeah.
watching. Hello. And sa lahat ng mga members ng Youth for Mental Health Coalition.
Thank you everyone for staying with us tonight kahit sa maulan na gabi. Thank you for watching.
Nakaka-adjit niya yung bag. Ano ba, Luz?
Mamaya yan, Doc.
Safe. Mag-ingat tayong lahat. Pero dyan muna kayo.
Easily triggered kasi. Anyway, sige po, go.
Okay. Let's continue with our discussion. So, ito po may interesting case na may phone-in question po. Taga Malabon po ako. Tapos may case ng psychosocial sa amin. Hindi na rin nakakainom ng gamot, kaya madalas sinusumpong. Dinadala sana nung family sa mental hospital, kaso di raw tinanggap ngayon. Kasi bumigay na raw, kaya pinalian na lang nila sa house para makontrol. Wala kaya pwede tumingin sa kanya? Or ano daw po kaya yung mga options na pwede po nilang gawin?
Mhm. Well,
Ako Luz, wait.
Yes, please.
Medyo na bad trip ako doon sa tinatali. Kasi hindi po tinatali ang mga individuals with depression. That's against human rights. Okay, so let's make that clear. Tapos, kung talagang although may component na walang pwedeng tumingin sa kanya, pwede po kayo mag-coordinate sa City Health Office ninyo for assistance because pwede po sila tumulong, lalo na sa gamot. Kasi meron na pong I think there's free meds na sa pag may mental health case. So, yun po. City Health Office po. Yan pa yung take ko dun sa question. Luz, yun.
I'm glad to say na ngayon, meron ding mga online consultations, Sa psychiatry, for one, maraming mga doctors na nag-online na. So, and to find your original doctor, you just have to call yung hospital where they are affiliated with. Nag-iiwan naman kami ng mga instructions where to reach us. That's one, yung hospital ng doktor ninyo. Pero kung talagang hindi ninyo ma-reach yung original doctor ninyo, you can try um, other big hospitals like Makati Med or Medical City kasi our doctors hold online clinic.
True.
Tapos pwede mo rin tingnan yung mga uh, association ng doctor. For one, yung Philippine Psychiatric Association. Meron kaming website and you can call the number of the office or the secretary and the secretary will help you locate a doctor. Meron ding sa mga website kasi ng mga associations like Philippine Neurological Association, meron silang directory of doctors. So I hope that helps yung caller natin ngayon.
Tsaka let's not forget yung LCMH hotline, yung 0917-899-8727. Yun, ano po yun? You can call that hotline.
Mm-hmm.
May link po kaming ibibigay after this talk na may directory. Kasama po dyan yung sinasabi ni Luz na Philippine Psychiatric Association doon sa MH Services PH. And may free mindfulness. May free mindfulness rin si Friendly Care sa Facebook. And kung kailangan nyo ng mga beyond COVID-19 group, promote ko na rin yung ginagawa ng Youth for Mental Health Coalition. Those are actually free support groups na pwedeng panuurin as a family. So at least meron rin bonding.
Keep safe.
Meron din kami, sorry sabihin ko na rin, may Mind Matters. Ayan, may Mind Matters po ang Philippine Psychiatric Association.
Paano nga ba yun, Luz?
Well, they can call our office secretary and she can set an appointment. She can set an appointment with us kasi meron kaming free services, no?
May number ka ba dyan, Doc, to call?
Yes, okay. Ang number ng aming secretary ay 0918-942-4864. Okay.
Siguro will repost na lang din po yung mga contacts later after this session para pwede nyo pong balikan.
At saka baka magalit sa akin ng isa ko pang affiliation, no? I'm a volunteer at Center for Family Ministries. We're now online.
Sepam.
That's nice.
Bigla ko naalala, Doc Gia, yung batang ni-rescue natin sa Region 1. Remember?
Grabe yun. Nagsimula yun sa umaga yun. May sinend sa akin si Joseph. Although we kept it confidential. Pero doon ko nakita yung power ng social connectedness. Tinali siya. So talagang we had to reach out to yung mga taga Norte, no, Seth?
Yeah.
Para ma-rescue siya. Yeah.
Ayan. May question dito. Please ask po if they are aware of treatment-resistant depression. If yes, how do you manage it po?
Luz, meron?
Meron, oo. Well, meron pa rin mga treatment-resistant depression. No? And how do we treat that? First and foremost, no, before we say it's treatment-resistant depression, we have to really investigate kung umiinom ba ng gamot yung pasyente sa tamang instructions ng doktor, no? But if sinabi, umiinom naman ng tama, sinusunod niya ng tama, we try to augment with another class of medications, no? Pwedeng yung tinatawag naming pang-augment namin, marami yan. Meron kaming mga second-generation antipsychotics. We use that. We have some mood stabilizers that we also use to augment. And meron din tayong electroconvulsive therapy or yung transmagnetic stimulation na tinatawag. So, hopefully, one of these things work, no? We try kasi wala naman tayong laboratory katulad ng ibang sakit eh. Di ba sa infection, meron tayong culture, we would know kung ano siya unresponsive yung pasyente. But honestly, no, sometimes it's becoming trial and error also.
Yeah.
Yun.
Okay, go ahead.
Sige po. Ito po yung next questions po natin. What are the warning signs and risk factors that persons with disability may be experiencing emotional stress or anxiety?
Mm-hmm.
Quality of life. Number one. Di ba, Luz? May ano yan eh. You have, tsaka ano, if you're already posing harm to yourself and to others, may ganong angle din. Pero number one sa book talaga is if it's already affecting yung quality of life mo, functioning mo. So, yan yung mga watch out for.
Mm-hmm. Or
Kaya
changes
pala,
in
kaya pala
changes in
mataas yung
behavior.
depression, no? Sa, for example, sa mga may psoriasis, no? Kasi talaga yung quality of life, kasi kita-kita siya sa balat, prone ka sa, tawag dito, sa mga staring glares ng mga tao.
Mm-hmm. Oo. At saka yung changes in behavior na sinasabi ni Dr. Gia. Like for example, someone is always happy, no? Laging makulit, masaya, tapos suddenly nagiging tahimik. Tapos hindi na siya nagpa-participate. Dati lagi siyang tumatawag sa'yo, lagi siyang kasama sa mga group chat, no? Nagko-comment, nangungulit, tapos biglang tumahimik. Meron siguro, that is one of the simplest way to put it. Basta may changes. But of course, yung anxiety, Gia, yung anxiety kasi, they manifest physically. Yung anxiety, kaya nga maraming may anxiety symptoms, they go to cardiologists, they go to ENT, they go to gastroenterologist kasi ang symptoms ng anxiety is like dizziness, okay? Or nahihirapan lumunok, palpitation, chest pain, nausea. So, minsan nagpupunta sila sa iba't ibang klaseng doktor only to find out later that it's anxiety.
Ito yung mga anxiety attacks, no?
Mm-hmm.
Okay,
And they're
siguro,
very disabling, ha? Kasi, tsaka may factor din na nawawala rin yung ability to take care of yourself.
yeah.
So, may ganon. So, yan lang yung mga parang general overview.
Eto na,
Go ahead, Seth.
diretso tayo sa next question na how do you deal with the disturbing information coming in like COVID and siguro itong bagyo?
Yan yung tinatanong ko kanina pa,
Exactly, ngayon pala siya papasok.
Ayan na. The big question.
Honestly, honestly, even as doctors, di ba, Gia, even as mental health professionals would get overwhelmed with all this information, no? So, dapat piliin mo lang kung ano yung, maybe choose one or two reliable sources of information. I keep myself to DOH. Sometimes I go to WHO. So, pareho lang naman halos siguro sasabihin doon, di ba? Okay?
Isa lang. Kahit...
Oo.
That's true.
You should know.
Sa Facebook kasi, di ba, parang expose na doon lahat. So, siguro the best thing to do is just to hide that, siguro. That article, hide mo lang.
Let's not forget also yung physical exercise. Kasi movement is important kasi lahat tayo, as of now, lahat tayo nasa loob ng house. Let's not forget yung aspect ng physical exercise. Kasi pag yung energy, nakakatulong yun mag-boost rin ng metabolism. If you're able, gumalaw rin, no? Let's try, pwede naman maglakad around the house. So, those are also some supportive measures na pwede nating gawin. especially para lang mawala yung, well, gagawin ko yan after we talk. Kasi nga na-adjust ako sa pag-Q.
O siguro, meron namang iba ako nakikita, parang ginagawa nila, they follow their other siguro, like paintings, di ba? Yung iba kumakanta.
That's true. At madami nag-o-offer din ng mga online na, kaya Zumba, o yun, diba, parang group class. Parang sometimes it already came to a point na you have to find creative ways para yung negative experience mo will turn into something that can be positive. Pero syempre hindi natin disregard yung feelings ng iba. But it will actually help if we find new ways every day kung paano tayo pwede mag-cope. Kasi iba-iba yan.
That's right, Gia, no? Kaya pala ang dami kong nakikita sa newsfeed ko na nagluluto.
Correct.
Diba?
Correct.
Ang daming mga kung ano-anong niluluto nila. So, maybe that's one way of distracting yourself from yung disturbing news. I-distract mo yung sarili mo, meaning, lulubangin mo yung sarili mo.
Yun.
Back to you po.
Ito po, medyo related ulit. So, we're talking about anxiety naman during these pandemic times. So, with all since bawal tayo lumabas, lahat nasa house lang, yung iba work from home, how do you find the feeling of loneliness or being cut off from everyone? How do you handle it?
Ito lang yun. It doesn't mean naman porket we're on a lockdown, we have to isolate ourselves from others. Dito papasok yung reach out to friends for support or family or whoever you feel comfortable with para lang ilabas mo yung feelings. That's very important. Kasi we will always, sometimes, nahiya tayo mag-speak up. Pero actually, when you talk about how you feel, parang that's already 50% of your chest. So, finding ways to be able to talk to someone, that will help battle yung isolation and loneliness.
Doesn't have to be physical connectedness talaga. Pwedeng, pansin mo ba, ang dami nang nag-zoom, ngayon nga, naka-zoom tayo, di ba? So, ang daming nag-zoom, ang daming
text mo.
Viber,
True.
So, hindi kailangan na you are physically near each other. Calling, texting, or video can do a lot of, lifting your mood, can lift your mood.
Yes.
This is actually the principle behind the creation of one of our programs, which we call SOR Coach Program. Kasi napansin namin, the patient will not open up sa isang doktor, halimbawa, yung true feelings niya or even sa family, they still try to hide it. So what we did is we empowered the patients to lead other patients. So with the guidance of the Philippine Derma Society, yung grupo ng mga psychiatrists natin, Philippine Derma Society, life coaches, ritual coaches, ina-empower nila itong mga patient leaders to guide the newly diagnosed patients kasi hindi sila nag-open. So, para at least may link sila to avoid the depression nga sana. So,
and I think, Seth, yung SOR Coach program nyo, that also addresses the community aspect of mental health. Kasi yun yung ine-encourage. Like sila, Luz, psychiatrist, konti lang sila. Konti lang sila sa Philippines, let's face it. We are, in terms of healthcare ratio, talagang it's low. So, dyan papasok yung you empower the community also to be able to at least yung basic support na kailangan ng isang individual. I think that's the importance of community care naman sa aspect ng mental health.
Knowing that you're not alone, diba?
Yes, exactly.
We always, our patients always say that na they know they're not alone. Siguro in any chronic illness, you know that you're not alone. Someone has been through that.
Yeah.
and you learn from that person yung experience niya. How did you surpass that trial,
Yes.
that uh, chronic illness?
Kami, siguro by, is that a question? Sorry.
Oo, kasi Seth, like you pointed out ang ganda kasi ng SOAR coach program eh. So siguro parang how do you sana ma-encourage din yung iba na
Hmm.
magkaroon ng similar na kasi best practice yan eh. We all need that eh na may mga coach. At least parang ang galing eh, 'di ba? You have already trained as far as before the lockdown may na-complete kayo na training eh kasi stalker fan niyo po ako, PsorPhil. So sinastalk ko po yung mga programs niyo.
We actually started with the concept sana ng SOAR Care program. Nilaunch pa namin yan sa Singapore. Ang ano naman dito, instead, hindi siya patients eh. Mga nurses, mga dermatological nurses. Pero we found out na it's not going to work out in the Philippines kasi konti lang yung dermatological nurses natin.
Mhm.
So, halimbawa sa Malaysia, ang ginawa naman nila, mga pharmacists. Ang ginawa
Okay.
nila, mga SOAR coaches, no? Pero kami, naisip namin, marami tayong magagaling na mga patients na, who can volunteer. So, I think, kaya siya nag-click yung program na yon. We are now on our 7th, no, Paul?
Coming 8 na this year,
Oh,
batch
sorry,
8.
8. Oh, batch 8 na ng SOAR coach. Ayan. So, actually,
Galing.
talaga,
Ang
matagal na
galing.
pala siya.
Congratulations and more
Galing.
power.
Congratulations talaga.
Ayan, baka pwede natin kunin si Dr. Luz na mag-lecture for sa next batch.
Oo nga.
Oh, Luz,
Sure,
go, push.
anytime. Sure.
Tapos ako yung sa entertainment.
Yun. So, ngayon po medyo next question naman about anxiety ba din? Paano naman daw po like kunyari PUI ka or PUM, how do you handle the anxiety? Then second question naman po, when you found out that you are positive in COVID, syempre mas heightened po yung anxiety and worries about it. So how do we handle those kind of situations po?
Mhm.
Okay, number one, COVID-19 naman is not a death sentence. No, in fact, more than 80% have recovered. So kung makikita nyo rin yung mga latest counts, nasusurpass na rin yung number of deaths. Having know the facts about COVID also. Kasi if you know about it, nalilesen din yung, you gain more control, no? So to speak, over what's gonna happen. So, constantly also reach out sa attending doctors nyo. Kasi ano yan, di ba? LGUs have, DOH already has a structure in terms of reporting. So, it will help if you're constantly in touch and know about your condition. Para naman dun sa COVID patients, you just have to always stay in touch with your doctor. So para and your family, of course, physically distance kayo, but you can be together by calling or diyan papasok yung yung communication. Luz.
Yung tungkol sa first question na anxiety, no? Anxiety of waiting, no? Anxiety of waiting, what will be the result? I suppose that's also the time kasi, Gia, na naka-isolate ka.
Totoo.
Diba? Naka-isolate ka, naka-quarantine ka. So what are you supposed to do? You have to prepare. You have to think in advance. Kung baga sa aalis ka, okay? Kung baga sa pupunta ka sa malayong lugar, ano yung mga dapat mong dalhin so that you don't get bored? So that you're preoccupied with something else rather than worrying about the results of your test, no? Siguro kung you're the type of person who can't live without your phone, your iPad, make sure you bring it along while you're on isolation, okay? And you know, during the first few weeks of ECQ, you know what I did? Si Gia lang kasi ang share. Eh. So, I wanna share with you what I've done
Yeah.
yung first few weeks. Kasi we are still in isolation. We are still in ECQ, di ba? So, pareho lang yun. Hindi lang nga ako naghihintay ng result ko. Pero it's the same, no? There's this anxiety, there's uncertainty. So, what I did, I canceled my Amazon subscription because I didn't need it anymore.
Mhm.
I called up my internet provider. I upgraded that. So sabi ko, ang dami kong nagawa, no? Not to mention the fact that I've decluttered, no? And
Ayan, cute.
I even cleaned up yung recycle bin ng laptop ko, uploaded my pictures from 5 years ago. You see, parang feeling ko nga kahit nakakailang weeks na tayo, kulang pa rin eh. Ang dami ko pa rin palang dapat gawin. But be kind to yourself, just do what you can. So ganun din, if you have this anxiety na you're waiting for the result of your test, make sure you keep yourself busy. Distract yourself.
And keep yourself informed also
Yeah.
about your condition. I think that's also number one. Parang facts lang, no? At saka if you feel that something is overwhelming, pwede naman i-let go. Pwede naman i-delegate habang
Mhm.
naghihintay.
Mhm.
Maganda yung point ni Luz na be kind to yourself. And decluttering talaga, sobrang tulong talaga yan.
Mhm.
Yun. So, before we continue, we're gonna have another break. Pero bago kami mag-break, magbabati po ulit muna kami sa mga nanonood sa atin tonight.
Yan. Divina Bunalagi.
Yeah. So, hi to Doc John B. Nanonood siya ngayon.
Hi,
Hi
Doc.
to, si Tita Emeline is watching. Hannah, hello. Jeng from Tarlac. Jad Pao from Iloilo. Marichong from Nueva Ecija. Fuji, Kuya Fuji from US. Thank you for watching.
Uy, hello! Wow!
To Serge.
Karen from Australia.
Yeah.
Hello!
International.
International!
Juby, to Joey, to Ray from Dialysis PH, hello. To Christian of Caloocan, Bashi of Cagayan de Oro, thank you for watching. Maricel, Divina Bonaldi, Angel, January Rivera, kay Nel Gonzalez, hello.
A lot of sir coaches are watching.
Actually,
Ay, hello!
tapos hi to Ate Amy from Baguio,
Baguio.
and Amore from Bataan, to
Sir
Rihanna,
coach.
to Josan, hello from Capiz,
Capiz.
to Maria, to Erwin, to Rosalinda from La Union, to Ate Cora from Valenzuela, to Jutay, hello, to John, sino ba? To
Emilu.
Orly, to Emilu, kay Marge, kay Hannah, kay Hans, hello. Kay Joaquin is also watching.
Ivy
also
Vergado
have
is watching.
Kabachete Herona, CBL from Saudi Arabia is watching. Hello. To Elton
IBL.
Jan Cepeda, to Michelle Bringuela, hello. To Neng, to Rickson from Laguna, hello.
Joey is watching too.
Hello!
Hi, Joey. To Jen Kulian Legaspi, hello. And sino ba? To RV, may
Yeah.
Japanese name, hindi ko mabasa kasi Japanese characters. Well, yun. So, to all our international friends who are watching
yeah.
from our
Masanuri-san.
community to IFPA community, yun. So, please stay tuned. After the break, we're gonna try to answer the live questions na mga comments nyo dito sa thread natin. So, see you back in a few seconds, guys. right, so good evening, everyone. Thank you for tuning in. And we're here in our third episode of PsorPhil Speaks with Doc Luz and Doc Gia as we talk about anxiety and depression. Also with me is my co-host, si Joseph from PsorPhil. So, yon. So, marami tayong live-in questions, no? So, di muna ako babate. And let's try to answer every question na-post. So, meron po tayo medyo female-related concern. So, paano daw po ba yung she's in a menopausal period, tapos hindi niya alam kung dahil ba to sa hormones or dahil ba flared up ako. Medyo moody po ako ngayon. And madalas masungit, tahimik, tapos ayaw kong masyado nakikita yung lesions. So, ano po kaya yung pag may mga ganito, ano daw po ba yung magandang gawin or dapat gawin?
Kasi highly, what's this? Highly related yan sa hormonal changes, especially pag pre-menopause. So, hindi natin madi-disregard yung possibility that it is related kasi ang menopause is kailangan wala ka menstruation for at least 1 year, no? Talagang wala na. So, hormonal changes can be a factor. Pero itong question na to, ibabato ko to kay classmate, kay Luz.
Mm-mm.
When will you know nga? Kasi yun, no? Paano mo nga? Kasi menopause siya, pero meron siyang manifestation na ayaw niya makita yung lesions niya. May changes. Siguro, yun yata yung concept ng question din eh.
Mm-hmm.
Paano? How will we know? Mag-seek na ng support.
Okay. Well, if you, I suppose she's not yet sure, kung kailangan niya ng professional help,
Yes.
help. So, but she's bothered. If she's bothered, then definitely she has to seek help. Ang question lang siguro niya, is it gonna be a psychiatrist or a counselor, a psychologist, no? So, if she's not sure, I know some patients are not comfortable going directly to the psychiatrist. So, perhaps you can get yourself assessed by a counselor or a psychologist, no? Baka nga minsan, talk therapy or counseling lang yung kailangan, but the counselors and the psychologists are trained also to detect if this individual needs psychiatric help. So,
Right.
any form of help is welcome, should be welcome to that individual kasi she's bothered eh. So, she just needs to seek help, siguro kahit muna sa counselor or psychologist. And the psychologist will be referring naman to the psychiatrist if needed.
Kasi tandem yan, di ba, Luz?
Mm-hmm.
Sabi, we always say that it's a team effort talaga ang approach sa healthcare.
Mm-hmm.
So, mas maganda kung lahat sana ma-cover.
Mm-hmm.
Yun. So, punta po tayo sa next question. Is anxiety, panic attack related or form of depression? What to do in case of these feelings?
Luz.
Iba kasi ang anxiety sa depression, no? Oo, I always get that question. Pero sabi ko nga, depression is when everything is low and slow. Yung anxiety parang laging agit,
On
sabi
the
ni
go.
Gia. Oo, laging kinakabahan.
Yan daw, na-agit ako kanina. So, anxiety na ba yun?
Yeah, pwedeng anxiety. Ay, hindi, pero, okay. Pero, ang anxiety is, yan, agit, parang di makatulog, restless. Yun yung mga symptoms ng anxiety. Okay? So, magkaiba siya, pero the anxiety can lead to depression, So, minsan magkakabit na rin sila magkasama sila.
Tama.
So, pwede yung anxiety, pwede siyang component ng depression and reverse. Tama ba, Luz?
Yes. Yung meron kaming depression with anxiety features.
Yes.
And anxiety can lead to depression.
Okay. Got it.
Tapos ito, Doc, What is the best remedy sa kabalat na depress? Tulad ngayon, isolated na nasa ibang bansa at malayo sa family.
Mm.
Mm. Mm-mm.
Yung mga OFW workers po natin, parang ganon.
Mhm. Alam mo, ang kagandahan sa Pilipino, kahit saang lugar may Pilipino, so may community of Filipinos, maybe he or she can try reaching out to the community of Filipinos there, no? That's one. But with the technology that we have, no, like internet, Facebook, mga social media, dapat ano rin try to reach out to your family. Always try to reach out to your family.
Or a support group or kahit kapwa Pinoy, pwede
Mhm.
rin, lalo na sa mga OFW natin. Kasi nakakatulong talaga siya.
Tapos ito po, Doc, when it comes to depression or anxiety, may a specific age po ba para magkaroon ng ganitong karamdaman? Paano daw po ito nakukuha or kaya po ba siyang ma-prevent or yun po, any preventive measures to do? Lalo na po, paano kung bata naman yung nakaka-experience po ng anxiety and depression?
Ang depression common in adulthood, no? Pero we see a lot of depression in the younger age group nowadays.
Mm.
But
Ano yan? Loose question. Sila yung, is that voluntary? Or based on your experience, pumupunta ba sila sa'yo because they want to, or are they accompanied usually by their parents based on your
the young ones, you mean?
Yeah.
You know, I am glad to say that the stigma is lessening. Andun pa rin siya, but the stigma is lessening. And the young ones are more aware, no? They know when something is wrong, and sometimes they will be the ones who tell their parents, I think I need help.
Totoo. Yeah, that's true.
Mm-mm.
Yeah. Because nga, I think yan yung result ng like ito, tong webinar na to, I think there is more awareness sa what depression is. Kaya tama si Luz, no? Mas nakakita na namin yung nakaupo. Okay lang umupo sa labas ng clinic na they don't they already came to a point na okay lang makita sila doon. Unlike before, empty yung corridor. Ang napupuno yung ibang part kasi they don't want to be seen. So, pero ngayon, it's a different scenario.
May stigma din, ano?
Yes,
Yeah,
meron
definitely.
talaga.
Definitely.
Na sana mawala. Yun
Pero
talaga yung
last
gusto natin.
year, ang sabi nila sa data is 15 to 19 years na mga kabataan are depression is the third the third killer globally
Yes.
in
Yes,
terms
that's
of
true.
morbidity.
Oo. And about your question how to prevent it, no? Kahit saang sakit, no? Be it physical or mental, emotional, no? It's always important to live a healthy lifestyle.
True.
No? Walang makakapalit sa healthy lifestyle. Meaning, eat right, no? Exercise, and avoid alcohol and drugs.
Doc. Sa akin, Doc, may follow-up question ako dyan, lalo na when it comes to children or teenage years. Kasi nga tulad nung nabanggit ni Joseph kanina, so parang may coach ka na high school student, college student, pero yun nga, he doesn't show any sign. Pero yun nga, suicidal na pala siya. So ano po yung masasuggest nyo for those who are watching right now, whether they are having these feelings? Ano po yung magandang outlet or dapat gawin para maiwasan po ito, lalo na po yung mga suicidal ideation?
Mm-hmm. find someone whom you can talk to, no? Pwede mong pagsabihan, no? Pero sa schools may mga counselors, and um, that's why there are counselors in school, because school age children spend most of their time there, di ba? Lagi silang nasa school, so most of their hours are spent there. So
Mhm.
find someone whom you can talk to. And
Right.
and for the parents, it's always important to communicate with your children. No, sometimes kasi parang masyado ng busy, no? Ang dami ng trabaho, ang daming problema. So we forget to ask the children kung kumusta na sila. Siguro nga ito yung sabi nung iba, yun yung isang magandang nangyari because of the ECQ. Kasi parents and children
Mm.
are both at home
At
right
home.
now.
Yeah. Totoo, madami nagkukwento na yung iba parang because of this, nakita na lang nila yung good out of it, na they were able to spend more time sa
Their family,
kids
no?
nila, their
Mm-mm.
family. Tsaka very powerful talaga yung sabi nga ni Luz, yung tanong na, how are you? Kumusta ka?
Mm-mm.
Kasi pwede yun mag-open ng madaming potentially walls na binild ng isang tao. Pero hindi rin namin din ine-encourage pag hindi ready yung tao mag-speak up. Don't force it.
Yeah.
I think it's enough lang na let that person know na nandun ka anytime na ready. Malaking bagay yon na alam niya nandun ka. Matatakbuhan ka.
Ayan.
That's good po.
Parang naalala ko yung sabi ko nga, parang mali yung sinasabi, mukhang depressed ka, may problema ka ba? Tinatanong niya na gano'n. So, he's
Oo.
trying to push yung someone na mukhang depressed siya. Sabi, hindi ako depressed. Hindi, mukhang depressed ka.
Yung parang pinipilit.
Pinagalitan niya.
Oo. Huwag niya pong pilitin kung ayaw talaga magsalita. So, yun. So, enough lang po yung physical, no, not physical. Ngayon ano lang, a text can mean a lot.
Mhm.
Yan. Tapos ito, Doc, next question about all of the things na nangyayari ngayon, how to switch negative thoughts to positive thoughts. Ang hirap minsan ng diversion kasi nakakatakot na. Yan.
Ako. Totoo yan. And yan na yung transition natin to, it will take time medyo, we have to manage, yung expectation natin, we have to also manage it, na the COVID will not be over after ECQ. So,
Yeah.
we really have to be extra careful pa rin. And we already have to, nasa point na rin tayo na we have to start accepting that things will change. Pero, never lose yung hope, yung parang, kasi minsan we all get days na parang wala na pag-asa, ano ba to? Pero I think just like any problem sa buhay, it will also pass. It's just that it will take time. So, tulungan lang tayo. I think very important yan.
Yeah,
Mhm.
reach out siguro.
Yeah.
Yes,
Ah,
reach
ah.
out.
And isang tinuturo namin, isang practice that we advocate is making a journal and writing there things that you are grateful for. Okay? Things that you are grateful for, like, okay, at least umulan, so hindi na ako magdidilig ng halaman ko ngayon, di ba? So, what are the kahit little joys, little things that you are thankful for. And that will make you open your mind and become more positive. Even if parang everything is falling apart. Find three things that you are grateful for.
Mhm.
Yeah.
Everyday yan parang may affirmation ka, practice mo na yan. Tsaka
Ako
walang
naman,
mababaw na sagot pa.
yeah.
Basta grateful ka.
Yung mga negative feelings ko naman, I usually write them. I
Mhm.
jot them down kasi that's the only way to express them na wala kang masasaktan na tao. And then I tear it up. No, pinupunit ko siya, tsaka ko tinatapon. At least naisulat ko siya. Na-express ko yung galit ko,
Nailabas.
Mm-mm.
nailabas.
Outlet. May outlet ka.
Tsaka meron parang naging ritual, no, Seth? Parang
Hmm.
you write it, tapos pinupunit mo siya, tapos tatapon mo siya.
Yeah.
Yun. Tapos ito Doc, medyo interesting na question. Nasan na nga ba yun? Wait lang.
Habang
Ayan.
hinahanap po, batiin ko si John at saka si William Del Yota. John of Valencia. Ayan.
Hello!
Yan,
And
nakita ko na.
hi,
Ay,
Dr.
sige.
Gia daw from Catherine Villena Mejia.
Ay, hello, Kat! Hi, hello.
Ayan.
Inaanak ko yan sa kasal.
Ito po yung next question. Regarding sa community naman and this quarantine season, is there any schedules daw po ba of mental health first aid training sa mga malalaking cities na you are offering with your organizations daw po?
Bawal po. Bawal
pa yun eh.
Bawal, okay.
Like
But
online platform or any, siguro yung sa hotline na lang po ulit muna.
Yeah.
No? Para makaano po.
Mm-mm.
Tsaka ano naman we will post also if there is an available venue. Pero moving forward, kung may nakikinig na part ng LGU in terms of sa pandemic response, please bigyan po natin ng weight yung mental health. Kasi yan na po yung that's going to be the second, third, fourth wave. Kasi yung nangyari na COVID, that's considered very traumatic. Kasi it happened, biglaan to eh. We didn't expect. And then after this, parang, di ba? So, I think part of a pandemic response will also, dapat bigyan ng weight yung mental health first aid. So, sana, yan po yung wish namin lahat dito after this webinar na please consider mental health first aid as one of your response.
And when you say mental health, we're not really talking about mental illnesses. We're talking about mental wellness. How do we ensure the well-being, the sense of well-being and calmness or parang sense of parang mental wellness in individuals.
True.
Yun. So far nabasa na natin lahat ng mga questions.
Wow, overtime na pala tayo po.
Oo nga. So, yun,
Napaka-interesting
siguro,
kasi eh.
na lang
basahin ko lang yung ibang dito po. Siguro hindi siya hindi siya questions, pero suggestion siya. Kung ano yung sinishare nila, kung ano yung ginagawa nila to battle yung research. Yung isa daw, nagjo-journaling, yung isa, watching K-drama. Yan,
yung iba yung mga crafts, tulad si Liza naman.
Oo. Ayan. Sige. Siguro, let's ask for the parting words ni Dr. Luz at saka ni Dr. Gia.
Okay. You know, if you're experiencing depression and anxiety, or stress and anxiety in these times, stress and anxiety during these times is a normal reaction to an abnormal situation. Okay? This is not an ordinary thing. This is something very new to us, unexpected, and still uncertain times, no?
Yeah.
So, recognize that your reaction is within normal range. Imagine mo kung wala kang sense of anxiety, you'll just go out there without a mask. No? You won't wash your hands. You won't put on alcohol. Hindi ka makikipag-social distancing. So a certain amount of anxiety is needed so that we can safeguard our health. But you would know when it becomes excessive and when you need help. For now, if you feel a little bit of anxiety, that's normal. And that's protective also.
Yeah, and to augment that, don't forget na ipopost po namin yung other, because importante, please reach out if you feel that you need help. Hindi po kayo, in this pandemic, we're all in this together. It's not like no one, basta, we're all in this together. And again, sinabi ko nga kanina, lilipas rin po. Ah, hindi lang ho natin alam kung kailan, but things will end. We just have to do our part. And thank you to PsorPhil for inviting Luz and I. Sana nakatulong po kami. And please continue your advocacy po because we really salute you. Thank you, Joseph. Thank you, Paul. Lisa,
More power.
more power. Kung nanood ka, Lisa, Ray, Dialysis PH, hello. So, thank you po. More webinars to come.
Ayan. Siguro ako naman, maraming salamat sa lahat ng sumubaybay. To all our friends all over the world, thank you very much for watching. Karen from Australia, Masanori-san from Japan. We have friends from Qatar, from
Wow.
Dubai. Thank you very much for joining us in this very fruitful discussion. And this might be the last of the series for Source Speaks, but we'll find ways uh, to be with you again in some in virtual forums like this. So for now, I would just like to say good night and maraming salamat po.
Yun. So, thank you sa lahat ng mga nanonood. We would also like to thank Johnson and Johnson for the educational grant for the PsorPhil Speaks. And we are now in our last episode. And the first week, we talk about dermatological issues with psoriasis. Then last week, we talk about psoriatic arthritis. And now, a very important part naman, we talk about mental health and how to battle anxiety and depression. And siguro ang pinaka-take home ko sa discussions natin today na even though we are isolated physically, there are a lot of ways for us to be connected with one another. And siguro make this time lang na to enjoy the time spending with your family. And ano siguro din, gusto ko rin yung sinabi nila kanina na be thankful because having a grateful heart, something within us is changing eh. Parang when you appreciate things, siguro the happy hormones starts to kick in sa atin. So, don't...
Pahabol po.
Sige, go.
Batiin ko lang sila Jingget, sila RJ from Mindoro. They're watching from Mindoro.
Oh,
Hello,
Hello,
Jingget.
guys.
Hi, Doms.
Ingat kayo
Thank you
dyan,
for
ingat
watching.
And Dom,
Dom,
thank you for the technical
Thank you.
support.
Thank you.
Yun. So,
Thank you to RJ also. Thank you.
To RJ Nagit. Thank you for watching. So, yun. Don't lose hope. Malalagpasan natin tong mga nangyayari na to. Mapabagyo man, mapapandemic. Tayo pa ba, mga Pinoy, kayang-kayang
Yeah.
lagpasan to. So, keep up the spirit, high spirit lang. And if you feel that you are anxious, sad, just reach out to your friends, to your family, to your community. So thank you everyone for watching. Good night and God bless.
you.
Thank you,
Thank you,
Dr.
guys.
Sentap Gia.
Thank you.
Thank you.
Thank you.
Thank
Thank
you,
you.
Doc.
Good night.
Thank you.
Good night. Good night.
Bye-bye.
All right, bye-bye.